about human skeletal system. The skeletal system provides the framework to our body. It protects the organs. It provides the shape and structure to the body. In adult, the skeletal system is made up of 206 bones. In children, the number of bones are more. It's near about 300. But after the growing age, the bones get fused together and it forms 206 bones. So what is bone? Bone is a rigid structure which is made up of calcium and collagen. The formation of bone, which is called ossification. That means ossification is the process of formation of bone. This ossification process starts from the 7 to 8th week of embryo and it continues up to 21 years old. So now we are discussing about the types of bone. In our body there are 5 types of bone. Okay. So there are 5 types of bone in our body. Number 1 is long bone. The example of long bones are femur, phalanges, etc. Femur means the bone of leg and phalanges means the bone of fingers. Next, short bone. The example of short bones are carpal, tarsal, etc. Next, flat bone. The example of flat bone is sternum. Next, irregular bone. The example of irregular bones are bones of vertebral column. Bones of vertebral column. The next is sesamoid bone. The example of sesamoid bone is patella, which is present in knee joint. These are the classification of bone. Details about the structure of long bone. This is the structure of long bone. In long bone, there are 2 ends which is broader. This broader end is called epiphysis. The middle part which is narrower is called diaphysis, and the space between diaphysis and epiphysis, this is called metaphysis. That means the 2 broader end called epiphysis, the middle narrower part is called diaphysis, and the space between epiphysis and diaphysis called metaphysis. So the epiphysis is made up of soft and spongy bone. In this part and this part, the bones are soft and spongy. This is made up of soft and spongy bone. The soft and spongy bone. Whereas the middle narrower part, that is called diaphysis, is made up of hard and compact bone. Hard and compact bone. And the epiphysis region contain red bone marrow. Epiphysis region contain red bone marrow. Red bone marrow and red bone marrow. These 2 epiphysis region contain red bone marrow, whereas the diaphysis contain yellow bone marrow. Yellow bone marrow. Now, the inner part of the long bone is called endosteum. Endosteum. The inner part, otherwise inner layer, is called endosteum, and the outer layer is called periosteum. Periosteum. We know peri means outer and endo means inner. Therefore, the inner layer or inner part is called endosteum. Next, we have to know about the functional classification of joint. Number 1 is sin arthrosis. Sin arthrosis means which joints are not movable. Immovable joints are called sin arthrosis. The next one is diarthrosis. The slightly movable joints are called diarthrosis. Sin arthrosis means not movable joint. Diarthrosis means slightly movable. Slightly movable. And the next one is amphiarthrosis. Amphiarthrosis means freely movable. Freely movable. So, we can see the fibrous joint is not movable and the sin arthrosis is also not movable. So, fibrous joint and sin arthrosis are same. And cartilaginous joint and diarthrosis are same. Synovial joint and amphiarthrosis are same. This is the classification according to structure and this is the classification according to function. That's why the names are different but the characteristics is same. Fibrous joint and sin arthrosis means not movable joint. Cartilaginous and diarthrosis means slightly movable joint. Synovial joint and amphiarthrosis means freely movable, possible to all direction. Now we are discussing about biomechanical joint. Biomechanical joints are of three types: simple joint, compound joint and complex joint. Simple joint means where two bones articulate. Two bones articulate is called simple joint. Compound joint means two or more bones. Two or more bones. Where two or more bones articulate together, this is called compound joint. The next one is complex joint. In this type of joint, there is also two or more bones articulate together, but there is a special structure. This is either articular disc or meniscus. This is the difference between compound joint and complex joint. In compound joint, two or more bones articulate. In complex joint, two or more bones articulate along with articular disc and meniscus. This is the overall classification of joint. Parcel act as a shock absorber and provide extra protection to the joint. Some example of synovial joints are knee joint,